Good evening, everyone. Is my voice audible? We will wait for another couple of minutes, friends. Let others also join. We'll start in 2 minutes. Right, friends. I think we are good to start. Just confirm. Is there any breaking today, or is it clear? Okay. As far as the recording of the previous case is concerned, friends, I'll share that entire case as well as the Google form after today's session is over, so that you can submit your remedies by tomorrow evening. So, as requested by a lot of members, few members have been continuously and repeatedly requesting me to, take a session on using the LM potencies. And from today onwards, we are just going to discuss on that same topic, how to use LM potencies. I think we can finish it off in maybe maximum 2 or 3 days time. So we will conclude that discussion on LM potencies because it is very much important for each and everyone to understand how to use these LM potencies. We already had a session on using LM potencies, I think, with some of our old members, but the new members who have joined after that, they may not have got a chance to attend that session. So, for the sake of their understanding, we will just quickly revise the basic things. We will not go into deep into that. Basically, the inspiration for me to start using this LM potency was received from a book called 50 millisimal potency in theory and in practice by Dr. Harimohan Chaudhary. I have the PDF of that. I'll share that PDF also in the WhatsApp group after this session is over. So please ensure that you are somewhere you save that PDF because it is going to be handy and useful for you. Even in case if you delete these sessions which we are having a PDF is always going to help you. So first of all, friends, before getting started with the LM potencies, we need to understand few things before we go in detail with understanding how to use the LM potencies. Now, I have been saying right from the beginning to all those people who have joined this platform that start using LM potencies, start using LM potencies. because in my career of last 20 years, I have been only and only using LM potencies. There is a reason for that, and the reason I'll also explain during this session today. Because when you are using decimal and centesimal scale, there is a lot of confusion involved in that. We will discuss about those confusions as well. We will discuss about those drawbacks of using the decimal and centesimal scales, and how using the LM potencies can be advantageous when we compare it with using the decimal and centesimal scale. So I think all members may be remembering that, first of all, as far as the results are concerned, when you are using LM potencies, I'm not saying that you don't get results when you use decimal or centesimal scale. I'm not saying that. But the speed with which you get the improvement and final result, the cure, what we call it, in chronic cases and even in acute cases also, using LM potencies has a lot of advantages. We will discuss that as well. The speed with which we get the results when you use LM potencies is comparatively much faster than what we get when you use decimal and centesimal scale. There are many people, majority of us still depend only on centesimal scale and decimal scale, and these LM potencies are not that commonly used by many practitioners. We will also discuss on the reasons for that as well. But as far as I am concerned, friends, when I got passed out in 2004, towards the end of 2004, I was basically confused in selecting the potency. I think this confusion most of us may be having if you are still using those decimal and centesimal scale. So basically, I can understand that in most of the colleges, no detailed explanation is given on using these LM potencies, and not too many colleges apply that as well. We will discuss on the reasons for that as well, because it is very important for us to know that as well. So same as the case, even in my colleges, I was not even aware of what these LM potencies are all about. But when you are sticking with the decimal and centesimal scale, as far as potency selection is concerned, which means that you are basically sticking with the fifth edition of Organon, because it was in the sixth edition of Organon, Henneman has introduced these LM potency or the 50 millisimal potency. So when you are depending on the decimal and centesimal scale, which means that many of us are still following the fifth edition. We'll tell you the reasons, we'll discuss on the reasons for that as well. But as far as selection of potency is concerned, if you are sticking with the fifth edition of Organon, can someone tell me what are the parameters that has to be considered before selecting a potency if you are sticking with the fifth edition of Organon? What are the parameters that has to be considered before selecting a potency according to the fifth edition of Organon if you are using decimal and centesimal scale? Yes? Is it audible, friends? No response even in chat. Okay. Susceptibility, age, then what? Stage of the disease, pathological changes, prognosis. These are all the parameters that has to be considered before selecting a potency. Do you all agree? Right? Now, it is also a fact that I think each one of you can confirm. Do we use all these parameters in each and every case before deciding a potency, friends? How many of us use all these parameters in each and every case before deciding a potency? What are the practical difficulties that we face when if at all we want to use these parameters? If at all we want to use these parameters, What are the practical difficulties that we face? What are those practical difficulties that we face if at all we want to use this susceptibility, stage, then the stage of the disease, prognosis, pathological changes? Okay, so if at all we take all these parameters one by one, first and foremost is the susceptibility. Now tell me, can somebody tell me how do we measure the susceptibility of an individual? How do we measure the susceptibility of an individual? We have seen that the susceptibility of an individual doesn't remain same. It keeps on fluctuating. And the susceptibility also varies from person to person. So, what is the parameter to measure the susceptibility of a given individual or a patient? How do we measure his susceptibility? Highly susceptible, yeah, he is less susceptible. How do we decide? How do we measure the susceptibility of an individual? On what basis? Susceptibility is inversely proportional. Ha, so that is true, ma'am. But is there any parameter to measure the strength of the dynamic protective covering? If we generally say that young adults have high immunity and hence low susceptibility, can that be applied as a general rule? If we say that young adults usually have high immunity and low susceptibility, can that be taken as a general? In today's generation, it cannot be accepted at all, because if you look at the trend, the people who develop the chronic cardiac disorders, heart problems, other heart problems, then respiratory disorders and other chronic complaints, they fall into this middle age category, isn't it? Can we make a general rule saying that small children usually have high susceptibility, low immunity? Can we make that as a general rule? Can we make that as a general rule? So what I mean to say is that, friends, even we say that, okay, the chances are there that when you grow old, the strength of the dynamic protective covering decreases and the susceptibility will increase. But that is again not a general rule. There are people who stay healthy till the age of 80s or late 90s. Not in this generation, but if you ask your grandparents, if some of you have your grandparents at home, maternal or paternal, you can ask them, or you can just cross check your health status and their health status. They will be much more healthier than what we are right now. So the age is also not a factor which will help us to decide the susceptibility. So practically we can say that, measuring the susceptibility is next to impossible. Precisely, we can make an assumption, like say for example, if a child is there of say 10 or 12 years of old age, and if you look at the past medical history, we come to know that the child is falling sick once in every 2 3 months. So we can say that, oh, this child is highly susceptible, has low immunity. But again, that need not be a general rule. That cannot be considered as a general rule. Past history, not always somebody, those who don't have past history of any medical illness, doesn't necessarily mean that they have a high immunity. Possibility is there that they may not have got exposed to the exciting factors for too long. So that is the reason they are remaining healthy, although their susceptibility may be low. So what I meant to say is that first and foremost difficulty when you are using decimal and centesimal scale is that it is practically impossible to precisely measure the susceptibility of an individual. Do you agree? So I think susceptibility is one of the biggest factor, most important factor, which will help us to decide the potency. So if you are following the fifth edition, what is the correlation? I may not be sure, friends. You only can confirm because I have no really, I have no, I'm not in using this decimal and centesimal scale. So I may not be sure, but you people, those who are using, they may confirm. According to fifth edition, if somebody is having high susceptibility, then you should start with low potency or high potency. आई एम नॉट श्योर बिकॉज मेरा उससे कभी वास्ता रहा ही नहीं है वो झंझट में. So I'm not sure, but there are instructions which are given. I know that. So if somebody is having high susceptibility, we should start with low potency or high potency. Okay, susceptibility means you have to start with low potency, and the reverse also applies. Lower the susceptibility, higher the potency. But if you look at the way the majority of practitioners are giving their suggestions और जो अपना ज्ञान बांट रहे हैं सोशल मीडिया प्लेटफॉर्म पे, आई थिंक कल के जो केस में भी हमने सुना कि ट्रीटमेंट वाज स्टार्टेड विद 200 directly, those medicines which were given, and somebody also had given 1 m. And you will come across doctors who initially start the treatment directly with 1 m, irrespective of the susceptibility. So basically, there are also people who start with 30, then go to 200, then go to 1 m, 10 m. Some people directly start with 10 m also. So basically, majority of those practitioners who are serving their knowledge under the name of clinical experience, वो अपनी खिचड़ी परोस रहे हैं. They have made their own rules for which there is no reference in Organon. Do you believe that all those people who still depend on the decimal and centesimal scale, do you think that they judge the susceptibility of patient and accordingly they start with a potency? Do you think so? Or everybody has their own rule. I'm a high potency practitioner. I will start only with low potency. I will start with medium potency. Everybody has made their own rules. So when you start making your own rules, which means that you are not following the law, you are not following the authority. And in homeopathy, Hahnemann is the authority. Correct? Unfortunately, many of us have failed to adopt the wonderful gift that he has given us in this expedition. We'll discuss on the reasons for that also, which is very important for us to know. We'll not discuss on the reasons which are given in the book. वो delay in publication हो गया, वो Hahnemann के वो sixth edition got completed in 1842. Then Hahnemann died, expired in 1843. So that it could not be published. It was kept that sixth edition was kept with his wife for many years for the money's sake. She did not allow it to publish. These all stories we read from the book. We are not discussing those things. We are discussing the practical problems as to explain why LM potency is not popular today among majority of practitioners. Many of the practitioners don't even know that LM potency, how to use the LM potencies. They don't know. And many of them also have wrong perception in their life. I have come across many people who tell that I don't use LM potencies because it causes aggravation. How many of you have come across people like this who say that, Are LM potency? Oh, it may cause aggravation. I don't use it. Have you come across people who say that? Yes. I think you may have come across many people who say that, but how many of us understand that Hahnemann has very clearly mentioned in the sixth edition of Organon, if I'm not wrong, I'll just confirm the aphorism number 246, if I'm not wrong. In the footnote of 246th aphorism, Hahnemann has in the footnote of is my voice audible, friends? I have just minimized the window and I have just taken the screenshot of this particular thing. Is it audible? Yes. Okay. So in the footnote of 246th aphorism, sixth edition of Organon, along while giving importance to the newly developed method, that is the LM potency, Hahnemann has also said that I'll just read it out. What I said I'll read it out. I'm reading it out from the footnote of the 246th aphorism, 6th edition of Organon, where Henman is saying that what I said in the 5th edition of Organon in a long note to this paragraph, in order to prevent these undesirable reactions of the vital energy. What do you mean by undesirable reactions of the vital energy? What is mean by undesirable reactions of the vital energy?
The
Is
aggravation.
is referring to is referring to homeopathic aggravation. Correct? It's very crystal and clear. There is no confusion in that. So, what I said in the 5th edition of Organon in a long note to this paragraph, in order to prevent, in order to prevent these undesirable reactions of the vital energy, was all that the experience I then had justified. I then had justified, matlab, it doesn't justify it anymore. Correct? I then had justified, which means that he no longer justifies those. It has to be replaced. But during the last 4 or 5 years, however, all these difficulties, including homeopathic aggravation, so all these difficulties are wholly solved by my new altered but perfect method. So, if at all we all believe that we are following Hahnemann, what is stopping us from accepting these lines? Where Hahnemann is clearly giving more importance and priority to use the LM potencies just because, apart from the other advantages, it will help to prevent the undesirable reactions of the vital energy. Or in other words, it will help to prevent the homeopathic aggravation. And what we are saying today, we are not using LM potencies because उससे homeopathic aggravation होता है. What is the sense, friends? Does it make sense? When Hahnemann is telling that with the development of this new method which he has developed, the problem of homeopathic aggravation is almost removed, completely solved that problem. And we are today not using the LM potencies, saying that अरे इससे तो aggravation होता है. Does it make sense? Now, these practitioners, friends, it's an interactive session, so at least I would request to please respond in the chat box at least. Otherwise, there is, see, in our application which we previously had, the class plus, I already have the recorded session on LM potencies. If you are not interactively participating, I'll download it and share it with you. Listen to it whenever it is possible. See, I'm trying my level best to ensure that I'm not expecting any response from your end. But that is a habit that I'm into since last many years. It is difficult for me to change that. Either you people change yourself or I will have to change myself to ensure that I'm just blindly and I will not even look into how many people are online. I'll just start the session and continuously keep on speaking without waiting for any response from your end. See, why I'm seeking response from your end is because I want to ensure that each and everybody is understanding these things. Just by knowing how to use LM potency is not going to help. You need to convince yourself, yes, why I need to shift to using LM potency. Okay? So coming back to these footnote of 246th aphorism, where Hahnemann has clearly said that this is a new, altered, and perfect method. And you know what? The funniest part is that, very funniest part is that I have come across some people who says that I've come across some people who had told me that when I quoted this footnote of sixth footnote from the sixth edition of Organon, very funny friends. Some people told that, some doctors told that, Array, sixth edition was not written by Hahnemann. There was a mismatch in the handwriting. Do you find it as do you find it as funny, or do you find it as there is some essence in that? See, if you believe so, we have to argue here. We have to discuss here. I'll tell you the reason why. They say that सिक्स एडिशन में हनीमैन ने लिखा नहीं था, वो हैंडराइटिंग में थोड़ा सा डिफरेंस था, जैसे कि इन्होंने खुद जाके देखा है। इनको कहाँ से मिलता है नॉलेज, पता नहीं कौन सी कॉलेज, कौन सी यूनिवर्सिटी से ये नॉलेज मिलता है। तो ये सारी जो चीजें होती है, ठीक है, अच्छा एक मिनट के लिए, फॉर वन मोमेंट, फॉर वन सेकेंड, इवन वी अज्यूम दैट व्हाट दे आर टेलिंग इज करेक्ट, हैनीमैन ने नहीं लिखा, ठीक है, हैंडराइटिंग में डिफरेंस था, ठीक है, बट जो लिखा है, ऑन व्हाट बेसिस यू आर गोइंग टू डिस्कार्ड इट? You are going to discard it just because you feel that it was not written by Hahnemann. In that case, where you are following the instructions given by Hahnemann till the fifth edition, you are not following that as well. So the people who make these kind of excuses, it seems that they are strictly following Hahnemann, whatever he has said, other than LM potency. That is not the case. So what I'm saying is that if at all that is taken for granted, चलो ठीक है, हैंडमैन ने नहीं लिखा एलम पोटेंसी के बारे में, या हैंडराइटिंग में डिफरेंस था, या जो भी है, वी हैव गॉट ए इंफॉर्मेशन, ठीक है, एंड गॉड हैज गिवन अस अ माइंड टू थिंक. So if somebody comes with this, see, in this platform, I think some people may be online to whom I had introduced this LM potency. I had insisted them to use it. Is anyone online who started using LM potencies after coming to this platform?
Yes, sir.
Who is that?
Yes, sir. Pooja, sir.
Yes, sir.
So how was your experience,
Sir,
ma'am?
there are so many.
There are so many,
Sir,
but I
it's
want
very
just
good.
want to have one or two people giving their feedbacks as to what was the result when they.
Sir, feedback
सर
is very
पुष्पा
good.
हियर सर.
सर, अभी तक तो कोई एग्रावेशन नहीं हुआ है एट द, मतलब जितने भी केसेस हैं सब इजीली, मतलब बहुत जल्दी रिजल्ट मिलता है एलएम पोटेंसी से, मतलब हम एक्सपेक्ट भी नहीं कर सकते उतना जल्दी रिजल्ट मिलता है.
Correct, very, and that is something that I have told you before, that this is what the advantage is. You try it for yourself. That was the only thing that I have told you, right? So what I mean to say,
राइट सर.
what I mean to say is that if somebody is telling you something, okay, do this, it will work, and you are not sure whether it is going to work or not. But before discarding it, can't you just give it a try? चलो ट्राई करके देखते हैं, तुम बोल रहे हो ना फास्ट रिजल्ट मिलता है, एग्रीवेशन नहीं होता, चलो मैं ट्राई करके देखता हूँ. आपको अगर रिजल्ट मिलता है, इफ यू आर गेटिंग द रिजल्ट, देन एवरी चांस इज देयर दैट यू विल अडॉप्ट इट. बट इफ यू आर नॉट गेटिंग रिजल्ट, देन यू मे come back to me and say that no, it is not working for me. So what I'm trying to say is that if at all those people who argue or saying that LM potency is the वो हैनमैन ने नहीं लिखा था, हैंडराइटिंग में डिफरेंस है, अरे आप ट्राई करके तो देखो, आपको रिजल्ट मिल रहा है तो और क्या चाहिए? Is it going to matter for us, friends, ki whether it was written by Hahnemann or it was written by Kent or it was written by Boni Guzen or it was written by, as long as the things are consistently working for us, we have repeatedly tested it, and things are consistently working for us, it is a true knowledge. And there is no end to knowledge, friends. Do you think that, see, I have a very sincere question, friends. Think and carefully answer. Do you think that after the discovery of homeopathy, until Hahnemann was alive, Hahnemann was alive, he worked on to improve it? So my question here is that, do you think that whatever Hahnemann could give us, the knowledge, the treasure, so much wonderful things he has given us, is that the end of homeopathy? Or is there any scope of taking it further from there if you really want to? Yes, friends?
we should take it further.
We should take it further. There is a scope of taking it further because there is no end to it. Homeopathy is a science and science is an ocean. There is no limit for it. Unlimited scope is there. But
Absolutely, sir.
to take it further from where Hanuman has left us, we should reach till him where he had reached. Are you getting my point? Until and unless we don't reach till that point where Hanuman has reached, following the path he has shown us, we cannot think about taking it ahead from there. Right? अभी आप लोग वीडियो गेम्स खेलते हो, पता नहीं वो पबजी है, वो कैंडी क्रश आता था पहले, उसमें डिफरेंट लेवल्स होते हैं। तो कोई ये लेवल पे है, कोई वो लेवल पे है, वैसे मुझे पता नहीं, मुझे वो गेम भी नहीं पता क्या है, लेकिन कोई बोलता था मैं इस लेवल पे हूँ, मैं उस लेवल पे हूँ। तो आपको अगर हायर लेवल पे जाना है तो सेम पाथ को फॉलो करके आपको उस लेवल तक जाना पड़ेगा, तभी आप उससे आगे बढ़ पाओगे। बट what has happened is that majority of us have failed to follow the path that our master has shown us. We got diverted in between itself. हम लोग आधे रास्ते में ही भटक गए इधर उधर। हम लोग, किसी ने उधर झुंड बना लिया, किसी ने इधर झुंड बना लिया, किसी ने उधर झुंड बन One person also told me that, see, these are the kind of excuses that people make in social media platform. One person told me that homeopathic practice is like kind of a tree. Just like a tree has different branches, different leaves on it, these are things. So there are a number of different methodologies. तो हम लोग वो पेड़ बन के रह गए हैं। अगर होम्योपैथी इज ए ट्री, then it should not be like a tree which has several branches. It should be like a coconut tree. एक ही path, just straight. Somebody has shown us the path. Somebody has shown us the path. So we should follow it. We should reach till a point. It is easy for us, friends. See, when Hahnemann discovered homeopathy and he continued to work on it to develop it until 1842, and in 1843 he expired. So whatever his findings are, the true findings, it has been included in the original. Do you all agree with that? All his findings, whatever he has noticed and recorded, all his true findings are included in the original. So if it has taken say 40 years or 50 years for Hahnemann to reach till there, and we already have a written directions, how long will it take us to reach till where he reached? If we are strictly following what Hahnemann has given us, how long should it take us to reach till that point where he had reached? कितना टाइम लगना चाहिए? अब मान लीजिए you are on a travel, you are trying to discover something. Let's say you're traveling, maybe you have gone for a trekking. Let's say you have gone for a trekking and your intention is to reach at the top. The person who is traveling first doesn't have any idea which way to go, which is the right path or which is the wrong path. But once he gets a clarity that yes, this is the right path, and he is leaving some directions for others who are coming from back, जो पीछे आ रहे हैं, उनसे जो पीछे आ रहे हैं, उनके लिए प्रिसाइज डायरेक्शंस छोड़ के जा रहे हैं कि आगे से यहाँ से, यहाँ से लेफ्ट, यहाँ से राइट, यहाँ से राइट, यहाँ से राइट, यहाँ से राइट. एंड लेट्स से he has reached to a point, peak 1, let's say, and he has very clearly given instruction for others who are following him to reach till P1. So it should not take for others who are following that much time which was taken by the first person, because the first person who explores the route, it takes more time for him. Right? So it should not have taken more than few years for us to reach there where he had reached. But हम लोगों ने क्या किया है? What we have done? We have got divided into groupism, different groups, this group, that group, this group, that group, and all those path that was shown by our master, nobody is bothered to follow it because we just want to survive. So utilize. See, just imagine, friends. Hahnemann was using this decimal and centesimal scale almost for his major portion of his life until last 4 5 years of his life. If he had felt a need that this method should change, don't you think that there is an essence in that? If he has felt that, it could have been a totally different story if somebody else would have come and proposed this idea of LM potency. No, it's not about universal opinion, ma'am. Yeah, opinions are different. The opinions are different because we all have our own perceptions and we are not ready to change our perception. That is the main point. But why we have different opinions, that also we need to discuss. We'll discuss that as well. So, as far as Hahnemann is concerned, if he was the first person who felt that this methodology needs to be changed, and the best part is that, friends, all those things which are being listed in the organon hold true even today. Nothing is discarded out of it. Is there anything that is discarded completely? From homeopathic perspective, whether it be the concept of miasms, whether it be the concept of the case taking, whether it be the concept of totality, whether it be the concept of individualization, has anything changed? Nothing has changed, which means that all those things which are given in the organon are completely true, even that even hold true today. Same is the case with LM potencies, but nobody is willing to accept it. Right. So coming back to the problems that we face when you are using the decimal and centesimal scale, first and foremost is the susceptibility factor. You cannot measure the susceptibility of an individual. अभी मान लीजिए अलका मैडम को मेडिसिन देना है एज ए पेशेंट, उनकी ससेप्टेबिलिटी मैं कैसे मेजर करूंगा? आई डोंट हैव एनी पैरामीटर, एंड हाउ आई विल डिसाइड कि मुझे लो पोटेंसी से स्टार्ट करनी है, हाई पोटेंसी से स्टार्ट करनी है? अब मान लीजिए फॉर इंस्टेंस, जस्ट इमेजिन दैट लेट्स से अलका मैम नीड्स ए हाई पोटेंसी, and since I am not sure, I am starting with a low potency, then what will happen? Then what will happen? What will happen, friends? If somebody, medicine may be the same. Let's say पल्सटिला देना है. It may not work. It may not cure the patient. Then we think about increasing the potency. So ultimately, see, you have to understand that the potency has to satisfy what? Potency that we are. See, at the end of the day, there is some curative power in our remedies, correct? We are just transferring that curative power to the vitality. I'll give you an example to understand this, friends. मान लीजिए, let's say I'm traveling along with, let's say I'm traveling with राहुल सर, ठीक है, मैं राहुल सर के साथ ट्रैवल कर रहा हूँ. अब मेरा नेट एग्जॉस्ट हो गया. I have completely exhausted my internet net connectivity. मेरा नेट का जो डेली पैकेज है वो खत्म हो गया. And I need to do something. I need to send a message urgently to someone. इसका मैं कौन है? अलका मैम कौन है क्या? Just mute it. ओके, सो लेट्स इमेजिन दैट आई एम ट्रैवलिंग विथ राहुल सर, और मेरा नेट जो है खत्म हो गया, अब मुझे अर्जेंटली आई हैव टू सेंड ए मैसेज टू समवन, देन व्हाट आई विल डू, व्हाट आई कैन डू, व्हाट आई कैन डू? रिचार्ज करने के लिए भी नेट नहीं है।
सर राहुल सर से हॉटस्पॉट यूज कर लेंगे।
राहुल सर से हॉटस्पॉट ढूंढूंगा। अब राहुल सर कहेंगे सर मेरा तो डेली 1 GB ऑलमोस्ट खत्म हो गया, मेरे पास तो सिर्फ 10 MB बचा है, या 20-50 MB बचा है, तो मैं क्या
Either you
बोलूंगा?
will ask to send him message regarding.
अगर अगर राहुल सर के पास 20 MB ही बचा है, तो मैं बोलूंगा सर एक बार शेयर कर दीजिए, मुझे सिर्फ एक मैसेज भेजना है, उसमें 100 KB भी नहीं लगेगा, इट इज इनफ फॉर माई नीड, दैट 20 MB वट एवर इज लेफ्ट विथ राहुल सर इज इनफ फॉर माई नीड, करेक्ट?
Yes, sir.
बट अगर मुझे एक वीडियो
राइट सर।
डाउनलोड करनी है, ये राहुल सर का 20 MB काम आएगा? नहीं आएगा, it will not be enough for me, it will not be sufficient for me if I have to download a video. So let's imagine that राहुल सर का मोबाइल है वो मेडिसिन है, और मेरा जो फोन है दैट इज दी माई बॉडी, एंड मेरी मेरी फोन की नेट कनेक्टिविटी है मेरी वाइटैलिटी। तो वाइटैलिटी की जरूरत कितनी है वापस रिस्टोर होने के लिए? वाइटैलिटी की जरूरत कितनी है? डिपेंडिंग ऑन दैट द पोटेंसी हैज टू बी एडजस्टेड। अरे हैव यू अंडरस्टूड दिस? अब जब जितना जरूरी है उससे कहीं गुना ज्यादा देते हैं तो क्या होगा? अब मान लीजिए, मैंने एक एग्जांपल दिया था बहुत पहले, अभी मान लीजिए हमारी अनामिका मैडम है, ठीक है, और anybody can just participate in a small activity, anybody who want to voluntarily participate, who will come forward? One person. I'll give you a simple example. What happens when you give high potency to a person who needs low potency? जिसको लो पोटेंसी की जरूरत है उसको अगर हाई पोटेंसी देंगे तो क्या होगा, मैं आपको बताता हूँ। कौन आएगा?
Yes, sir. Yeah.
Who is that?
Pawan, sir.
Pawan. Okay, new batch member. Pawan is our one of our three
Yes, sir.
members from the new batch, friends. So very active member. Thankfully, we have got one more male active member added from this batch. So Pawan, I want to know, do you eat chapatis or rotis for your lunch or dinner or whatever it may be?
Chapati.
Chapati.
Chapati, sir.
Okay. So how many chapatis you can eat?
2,
Two. Okay.
2 or 3. Yes.
What if I'm
Yeah.
giving, you are very hungry, and I'm only giving you half a chapati, then what will happen?
It will not satisfy me.
It will not satisfy your hunger. ठीक है, चलो ठीक है. So
Yes.
you need one, I will give you one. You want more? You want one more?
Yeah.
I'll give you one more. ठीक है, two. You want one more? I'll give you one
No.
more. Three. You want one more? Can you eat one more?
No.
I'll still
No.
give you. You have to eat it. Four. You want one more? I'll give you. You have no option. You have to eat it. Five. I'll give you one more. You have to eat six. Compulsion. Compulsory. I'll give you one more.
Then
Seven. Eight. What will happen?
vomit out हो जाए.
Vomit out हो जाएगा. जो excess है, that will be thrown out. और जो
Yes.
vitality जब throw out करेगी, it will not come outside. It will come out in the form of aggravation. It will come out in the form of aggravation. So a person who needs a higher potency, if you are giving a low potency, उसकी भूख नहीं मिटेगी, और जिसको भूख मिट गई उससे जरूरत से ज्यादा देगा तो एग्रीवेशन होगा. अंडरस्टूड? क्लियर फ्रेंड्स?
यस सर।
Yes.
Now the biggest disadvantage of using decimal and decimal scale. वो कहते हैं ना, ये कमान में से तीर निकल गया तो फिर हमारे हाथ में नहीं है, मुंह से निकला हुआ वर्ड और कमान से निकला हुआ तीर वापस नहीं ले सकते. तो ये जो पोटेंसी आपने एक बार दे दी, योर हैंड्स आर टाइड, यू कैन नॉट मॉडिफाई इट बिकॉज इट हैज ए लॉन्ग एक्शन. 30 days, 45 days, 50 days, 60 days. Once the potency is given, you have to wait how the body is going to react. मतलब रिएक्शन नहीं आया, अच्छा 30 दिन के बाद, आफ्टर वेटिंग फॉर 30 days, you feel that no reaction. Or after waiting for 15 days, you feel that no reaction. After waiting for 15 days, you are saying no reaction. Oh, I should increase my potency. So basically, your 15 days to waste gaya na. Your hands are tied. Your hands are completely tied when you are using decimal and centesimal scale once you have prescribed the remedy. अब aggravation ज्यादा हो गया. If there is aggravation, पर इतना हाई पोटेंसी नहीं देना था, क्या करेंगे? एग्रीवेशन हो रहा है, अभी एंटीडोट ढूंढो उसका. So much headache, friends. So much headache. Still confidently people prescribe, keep on prescribing higher and lower potencies as they wish. As they wish, they do that. And not only one medicine. Sometimes one medicine in 30 potency, some medicine in 200 potency, some medicine in 1 potency at the same time. So we are playing with the health and life of our patients when we are doing this kind of practice. Nobody is sure, friends. If you ask about potency, nobody is sure. Everybody has their own rule to select a potency. Everybody has their own rule to repeat it as well. Some people say that single dose and wait. Some people say that continuously twice a day for 3 days and then wait. अरे क्यों? कहाँ दिया है ये? नहीं, वो मैंने रूल बनाया है मेरे एक्सपीरियंस में. Some people will say that although it is a long-acting medicine, repeat every alternative days, repeat every once in a week. हाँ, अपने अपने अपनी खिचड़ी अच्छी खिचड़ी परोस के रखी है. अब आप बिरयानी खाने जाओगे फ्रेंड्स, 10 जगह पे 10 बिरयानी मिलती है. बैंगलोर में जो बिरयानी मिलती है वो अलग होगी केरला से. केरला में जो बिरयानी मिलती है वो अलग होगी हैदराबाद में. हैदराबाद जो हो सकता है दिल्ली में जो बिरयानी पूजा मैडम बनाएगी वो अलग होगी हमारे यहाँ से. तो इट इज लाइक दिस काइंड ऑफ रायता फैला के रखा है सब लोगों ने, अपना अपना रूल सबने बनाया है, मैं उसी को फॉलो करूंगा. एंड व्हाट हैपेंस इज दैट these people who claim that they have experience, when they sit out to teach others or guide others, what will they do? They will not tell that what is given in the original. They will only pass on that message or that knowledge, so-called knowledge, which may be incorrect, which may be imperfect, as it is to those people who are following. And the followers, what they think? Arey, sir has 30 years of experience. How can he misguide us? What he's saying must be true. So if I tell something here, again and again, I always say that don't blindly accept it. सेम इज द केस विद एलएम पोटेंसी. मैंने जब भी लोगों को बोला कि स्टार्ट यूजिंग इट, स्टार्ट यूजिंग इट, स्टार्ट यूजिंग इट, then you will come to know how much effective it is. Right? So why you need to discard the use of LM potencies? Sorry, discard the use of decimal and centesimal scale. We discussed about the susceptibility. Now the age factor, second one. How is age related to potency? The lower the age, lower potency or higher potency? How is it is related to age?
Sir, the lower the age, the lower the potency.
The lower the age, lower the potency. So does that mean that unconditionally in people who are very young, especially small children, you can unconditionally start with low potency? Is it unconditional
Yes, sir.
rule?
Yes, sir, यही सुना है.
Can we so why it is said that lower the age, lower the potency? Because lower the age. Now how is susceptibility? We just discussed about susceptibility. Higher the susceptibility, lower the potency. That is what you people told, right? What is the relation with susceptibility of potency? Higher the susceptibility, just little while ago it was discussed, right? See, I will not keep that in mind, क्योंकि यहाँ से सुन के मैं यहाँ से निकल जाता है.
सर जो एक्सपीरियंस डॉक्टर्स हैं वो कभी भी ये नहीं बताते ससेप्टिबिलिटी वाला फॉर्मूला, वो चीज बताते ही नहीं है, वो चीज नहीं समझाते। वो सिर्फ लोअर द पोटेंसी, लोअर द एज, हायर द एज एंड क्रॉनिक डिजीज है तो
मैडम
हायर
मैडम आप मुझे
पोटेंसी से
बताइए,
स्टार्ट कर दो।
कोई चीज अगर उनको खुद नहीं समझाया तो आपको क्या समझाएंगे?
वेरी राइट सर।
ससेप्टिबिलिटी के ऊपर का क्लास याद है ना आप लोगों को? अभी नए मेंबर्स का हुआ नहीं है। ससेप्टिबिलिटी इज नॉट सच ए सिली थिंग, है ना? सो नाउ एज ऑल्सो इज नॉट ए डेफिनेट पैरामीटर, एज के हिसाब से नहीं होता है। अगर आप मान के चलोगे कि ओल्डर एज पीपल हैव गॉट यूजुअली हाई ससेप्टेबिलिटी, लेकिन हमारे हमारे से स्ट्रॉन्ग इम्यूनिटी उनकी होती है। दोज पीपल हैव मच मोर बेटर इम्यूनिटी देन व्हाट वी डू हैव। तो उनका ससेप्टेबिलिटी हाई कैसे हो गया? So there is no parameter. There is no parameter. Age is also not going to help us. अब susceptibility नहीं, which is the main factor, is not going to help us. Age is not going to help us. Now the pathological changes. The more advanced the pathology, according to fifth edition, the more advanced the pathology, lower potency or higher potency?
Lower potency.
Lower potency. What is
लोअर
the reason for
पोटेंसी।
that? What is the reason for it? Does anyone know what is the reason for
If
it?
it is high potency, then chances of aggravation are there in pathological cases. Higher potency, more aggravation.
Higher potency aggravations are there. Again, apart from that,
Already pathologically compromised patient.
अच्छा एक टिप मैंने एक
Killers
डॉक्टर,
aggravation.
सुनिए ना फ्रेंड्स, एक टिप मैंने अभी, इट इज नॉट रिलेटेड टू दिस टॉपिक बट इट केम इनटू माय माइंड बिकॉज इट इज रिलेटेड टू व्हाट with respect to the topic, present topic that we are discussing on advanced pathology. One doctor told me that in advanced cases of pathology where the patient is has got very advanced pathology and may be fatal, may die also. If you are giving arsenic in high potency, it will ensure that the patient will die very smoothly. And if you are giving in low potency, the patient, it may help the patient to recover. So if you decide, if you are as a doctor, if you decide that this patient is not going to survive, he's suffering a lot, to ensure that he dies very calmly and peacefully, you can give arsenic in higher potency. Does this make any sense, friends? Have you heard it any time? I have heard it from a number of doctors.
Yes sir, I have heard it.
Does it
No.
make sense?
No, no sir.
They mean to say that, they mean to say that the vitality can be, now when is a person going to die? A person will die only when the vitality has got completely exhausted, right? So these people are saying that our remedy has the potential to exhaust the vitality. What logic? It's called absolute stupidity. It is called absolute stupidity. और वो पेशेंट अगर आर्सेनिक का है ही नहीं तो, if the totality is not matching with arsenic, then what happen? What will happen? Is it going to work? It is not going to work. Right. So coming back to the pathology. Now in advanced pathology, what happens that if we are now see our at the end of the day with our medicines, we are giving a push to the vitality, correct? We are just boosting that vitality. We are giving a push to that vitality. Now, if the advanced pathology means what? There is advanced destructions at a materialistic plane. There is advanced destruction at a materialistic plane. Now, we have studied that in the very beginning that these two planes, that is the materialistic plane and the dynamic plane, they exist in what do you call it? Tandem. They cannot exist in isolation. If the vitality get exhausted, materialistic plane also exhaust. If the materialistic plane get exhausted, the dynamic plane also get exhausted. They cannot exist in isolation. So what happens is that in advanced pathology, there is a massive destruction at a materialistic level. If the vitality is pushed immediately to a higher level, which may respond positively, but to accompany or to go with that positive response, the materialistic plane is very weak and destructed. It may not cope up and it may collapse. Understood the point? अब जिसका हाथ पैर टूटा है, हड्डियों में फ्रैक्चर है, वो लेटा हुआ है आराम से, चल नहीं पा रहा है, उसकी वाइटलिटी भी वीक है, इसलिए वो उठ भी नहीं पा रहा है। अगर उठने के लिए उसको एकदम से वाइटल पावर दे दिया और वो अचानक उठ गया, उसके हाथ पैर टूटे हुए, कैसे चलेगा वो और लुढ़क जाएगा। Getting my point? So in such cases, we are giving small pushes to the vitality, and that vitality absorbs that positivity, and that positivity will slowly ensure the reversal of that pathology. So in advanced cases, that is quite true to a great extent, that in advanced cases of pathology, you should not start with high potency. But again, if not high, which is low? Is 30 low? 200 low? Or we have to go beyond, further down to the triturations? What do you mean by low? What is the definition of low potency? Is there any parameter? कितना लो देना है? मदर टिंचर देना है या ट्राइचुरेशन में देना है या 30 देना है? कौन सा लो कौन सा है? 200 देना है, कौन सा लो है? Do we have any guidance, proper instructions or proper parameter to decide that? No. Again, this advanced pathology. तो आप लोग potency, if you are using decimal and centesimal scale, how you are going to be sure that the potency you are giving is the correct one for your patient? Is there any way? There is no way. Absolutely no way. So for all these problems, the solution is what? What is the solution?
LM
LM potency.
LM potency. Right? So today's session was just an introduction about the disadvantages of the decimal and centesimal scale, and comparatively tomorrow we will discuss what are the advantages of LM potency, how to decide the potency, how to repeat it, when to start it, when to increase the potency, when to decrease the potency, when to dilute it, on what basis, when to stop the medication, what about second prescription, which potency to start with during second prescription. All these things we will start discussing in the next 2 days time. Okay. So with that note, friends, we will wind up today's session. It has been a 1 hour session today. So we will wind it up for today, and tomorrow we will go in detail with that. Okay. So let me know how was today's session in the WhatsApp group, friends. We'll continue from here tomorrow. Thank you and good night. And I'll share the recording and Google form little late night, but please ensure that you are submitting it by tomorrow. Good night to all.